Assalamu alaikum. You're watching Views and News and I'm Faisal Rahman live from our Islamabad studios. Today we'll be talking about the current COVID-19 situation in Pakistan. As we all know that the total number of cases globally, they have exceeded 11 million, whereas around 530,000 people, they have died so far. Many have recovered, but when it comes to Pakistan so far, the number of positive COVID cases, that is around 230,000, out of which 131,000, that's more than 60%, the people have recovered. Around the number is well under 5,000, the number of people who have died because of coronavirus. And yesterday there was very tragic news of one of the former ministers of Pakistan People's Party, Mr. Ayatollah Durrani. He also passed away because of corona, and a couple of other legislators as well about a month ago. So this is something which is very serious. I am still going to refer to the statement of Sheikh Rashid Saab after recovery from COVID-19. He said that this is a disease, I wish it should not even happen to your enemy. So the point is that one should not take it lightly. Shahbaz Sharif Saab has recently recovered from it, and he was also a patient of cancer. Our advisor to the Prime Minister on Health, Zafar Mirza Saab, Dr. Saab got sick today, and I learnt that he has also self-isolated himself in the house. So what I'm saying is that this is something which is there. One has to take precautions, one has to follow the protocols, one has to make sure that all the precautionary measures should be taken seriously. Wash your hands, make sure that you do not touch your nose, your lips, or your mouth primarily, or your eyes. These are the things. I mean, generally when we even sit on this table, I make sure that I spray it with the basic necessary germ killers, and then we clean basically the wires even. The point is that one has to take the precautions. This is something which seems to be missing. Last time, because after the Eid, we all witnessed that there was this huge surge, and even now the Eid is coming and one has to be very careful. But talking about this in detail, this was the basic number today. The Prime Minister also went, and it was very good news that there's this huge setup where Pakistan has started manufacturing the portable ventilators, and that's great news. He also gave a first huge block of those very interesting new product for Pakistan to the NDMA. And I think Pakistan will be able to manufacture and even get better in this field. So wherever there is a problem, there is an opportunity, and this is something which one should feel proud of. Now, to talk about this in detail, we have with us Dr. Nouman Zafar Saab. Dr. Nouman Zafar Saab is the head of infectious diseases. He is an expert. Dr. Saab, thank you very much for taking out time. We also have with us Dr. Nazir Mahmood Saab, senior columnist, and he writes a lot about this particular epidemic. Thank you very much, Dr. Nazir Saab also. Well, Dr. Saab, starting from the current situation, what we have witnessed that recently there is this new surge in United States of America. Primarily, a lot of people believe that the youngsters, they're not taking care of this particular, I would say, pandemic or epidemic, as they say. And on top, now a lot of people between the age of 30s and 20s, they are getting affected. Number one, the reason, primarily, we all thought that youngsters could stay away because of their immunity, but this seems to be the other way around. Secondly, sir, now they believe in Pakistan that there is a flattening of the curve, but still it has been told that the month of August should not be taken lightly, and this particular month of July, one has to be very, very careful. So tell us about this flattening and how do we take it down further, sir? Dr. Nouman.
Thank you very much for me being here. So yes, so if you see United States, you can easily see what happened when you take it lightly. So especially Florida, where I'm right now, they opened it too soon, too quickly, and the people just like went back to their lives just like as regular. And you can see how many number of cases every day, around 10,000. Even the day before yesterday was 11,400 in just one state. So again, if the curve is flattening in Pakistan, I mean, every single person has to be careful. The problem here is people are not careful. They're just very close to each other, like doing regular routine. This is not a time for a regular routine stuff. We have to be careful. I mean, especially, yes, you said already said washing the hands. I mean, honestly, in a day, I probably wash my hands like 25 times. And then we use hand sanitizer, anything we touch. Even that, if you're touching something, I consider that this is contaminated. And when I touch back to my phone, the phone is contaminated too. So you have to be very careful, even small things. And if you are like taking care of them, then you stay away from the infection. And this, yes, this infection is not simple. Means we have here even like a lot of big names, some doctors, big doctors, some like specialists, some politicians. They are really sick. Some people have died, and same thing is happening in Pakistan.
Yeah.
Whatever your age is, you cannot take it. You cannot take it lightly. Honestly speaking, this is something
Sir,
real,
those who have
genuine.
taken
Please.
it lightly are suffering also. I mean, initially, we got to know through people. Now, I practically know people who died and who suffered also. Now, Dr. Saab, another point. Uh, in London, for example, in UK, when they lifted the lockdown restrictions primarily, a lot of people came out. They went to the pubs, to the bars, to the restaurants. Again, it surged. Now, when we talk about the smart lockdown, primarily we all believe that the moment the government is going to announce that the lockdown is over means everything is fine, it's back to normal. No, sir, it is not. Please also explain that to our viewers. And secondly, when you talk about this particular issue that, okay, now the curve is flattening so we can get casual, that is something one has to follow because of your previous lockdown or your behavior during the last 14, 15 days. The curve has flattened, but you need to continue with the same behavior for another 3, 4 weeks to let it go down further. Dr. Saab, your comment?
Actually, not only 3, 4 weeks. I would say until we have vaccine, we have to continue the same behavior that every single place is contaminated, everything is contaminated, because until unless we have vaccine, the problem is in English, there is a slang. It's called as dropping the ball. So basically, what happened here in United States, they dropped the ball. So you cannot drop the ball. Now you, for example, flatten the curve, the numbers are going down. As soon as you flatten the curve and then you drop the ball, here is back. It's just going to come back right away. So next, not even 3, 4 weeks, I'm honestly saying until we have vaccine, that may be up to 6 months to maybe 8 months, we have to be really careful. It's hard. It's even hard. It's depressing. It's sad to think about it. But the point is, what should we do then? On the other side, people are getting sick, ICUs, ventilators, and not surviving. And means there's some people survive. Means a good number of people survive. But the point is, do you really want to get this disease? I mean, there are some people who get lung damage. Even if they survive, they're going to get lung damage. So I don't think anybody should even think about getting this disease. There are some people I met. They said, "Oh, we were going to get the disease anyways. So why don't we get it early? So we get antibodies." I said, there is not 100% that you're going to survive this disease. Even if you survive, you may
Absolutely.
have like chronic damage in your lungs and maybe other places.
Absolutely. Now, over to you, Dr. Nazir Mahmood Saab. Now, looking at the condition in Pakistan, uh, when we talk about the number of tests conducted every day, that isn't that much according to the number of people living in Pakistan. Look at the population. And then you are primarily talking about the cases only in the rural areas, not in the, primarily in the urban areas, not in the rural areas. It's the other way around. A lot of people come and go back and then the weekends and plus the coming Eid also. This flattening of curve currently which we are seeing, do you think it is going to remain straight, could go down, or if the proper measures are not taken into account, it can still go up the way it was actually about a month ago?
Well, I think there is in Pakistan good both. There is a good news and there is bad news. The good news is that we have been able to control uh, the spread of infections. We have fared, I think, much better in comparison with some of the European countries or in comparison with even in India. The number of deaths there are much higher, number of infections there are much higher. So
Number
somehow we
three
have been able
country in the
to
world.
control it. So I think this is good news. Now, something about bad news. The bad news is that this lower number of infections may be the result of lower number of tests. So we have probably not conducted as many tests as we should have done. So if more tests are done, probably the number of infections will probably increase. This is one. And secondly, there are number of deaths probably which are not recorded as COVID-19 deaths. So people are of course dying. Just today I was checking the data, and according to data of Karachi and Lahore, in comparison, the June data of number of deaths in Karachi and Lahore with the June 2019 data. So, and the data said that in Karachi also the number of deaths in comparison with the previous year, the same month was almost double in Karachi. And it is almost 2.5 times more in Lahore. So that means if you compare with the previous data, the deaths are taking place, but probably we are not registering them as COVID-19 deaths. So this might be one cause of lower number of deaths. And secondly, still the precautionary measures that we should have been taking, our people are not taking that. Though the government has, I think, overall tackled it intelligently. Pakistan could never afford a complete lockdown, so did not impose a complete lockdown. This smart or partial lockdown was probably the right way to do it. So we have been handling this in a slightly better way. How the curve will move forward in near future, it is yet to be seen. So there are two opinions. One opinion says that the peak is yet to come. So people say that after probably in August the peak will come, and after that the number will further go down. But this we have been hearing for past 3 or 4 months. So it is very difficult to say how this curve will develop in future. To a great extent, it will depend on how our people respond to it and how the government respond to it. We should not take it lightly.
Yeah,
and
Nadir
we
sir,
should
what about,
keep
I mean,
our
I really
efforts.
would like you to comment also on a good news. Today, we learned that there is this assembly set up close to Haripur, where the Prime Minister visited today. I saw Mr. Omar Ayub, the Federal Minister for Petroleum, as well as the head of the NDMA and a couple of other senior officials along with him. And we got to know that Pakistan has started manufacturing the ventilators, rather the portable ventilators inside Pakistan, 100% indigenous. Your take on that point, sir? At least we have learned something to do.
Yes, I think this is a very good news. I just saw that news item also. I think that is a very positive development that Pakistan now has been able to develop our own local ventilator. And I'm sure that they have done proper required testing of the equipment also.
I'm sure they have.
Because, if we, yes. So, if that equipment is ventilator, locally produced and ventilator is successful, and I'm sure it will be because it is done by people who are responsible. So, I think that is a very good news. And if the situation deteriorates in near future, and if we need more ventilators, I think this is a good news for Pakistani people, especially who are God forbid, if there are more numbers of infected people, and if we need more ventilators, these will be very useful for us. So I agree with you that this is a very good development, and this will stand us in good stead in the near future.
All right. Now, coming back to you, Dr. Numan, now, when we see that things are getting in control in Europe, USA, there is a second wave. But when you talk about New Zealand, that for that matter, I mean, they've totally taken charge, and I mean, COVID-free country, they have declared New Zealand. And when you talk about South Asia, in particular India, sir, India has become the third largest affected country in those terms. Even only yesterday, I mean, there were more than 25,000 cases reported in India, more than 700,000 in general, about they'll be hitting 1 million maybe in another week's time or something. Now, do you think a neighboring country can get affected as well? For example, let's suppose if it's really multiplying, but obviously human contact isn't there, but like a virus, do you think it can spread from one area to area primarily, from city to city without the human contact at the moment, sir?
No.
Or maybe one person who's carrying could multiply again?
I mean, one person can actually bring it. So if somebody coming from India, that's what you're asking, right? So from India to Pakistan, right?
Yeah.
But not if you're not having contact with people, it cannot spread. The virus needs a host. So even if, for example, we say this virus can be airborne, but the airborne is like 3 feet, six
Because this
feet.
is what
That's
we
it.
have
So
heard, sir. It is possible that it could be airborne also. You don't need a human contact to get it, basically.
but
For
airborne
if
in
you're
that
saying that
area.
there's a problem in the not a problem, but if there is a ventilation, like our office for that matter, it's centrally air conditioned. So if somebody sneezes in room number 3, what about the person sitting in room number 5? That's what my point is again.
Yes, it can be airborne. I mean, I'm sitting in an office, so we have ducts. So ACs have, there is a suction and then there is a blow. In the local vicinity, if the building, it can be airborne if somebody is really sneezing and it's a small particle. To be airborne, you need to have less than 5 microns. And so it can airborne in that area, but it cannot airborne like miles and miles. It is
Okay.
not possible because it will eventually fall down on the ground and then it will not go. So if we have no contact with a neighboring country, for example, India, and there is no flights coming in, there's no trains and no people in contact, it should not spread. It should not spread without a person. It basically is a person-to-person spread. That's how it is. Person to person spread, again, there are 3 ways. Again, there is like direct contact, there is droplets,
Now, two
and
more
then there
quick
is
comments, sir,
airborne.
because there were mixed stories that if somebody already has it, that person has developed the immunity, cannot have it again. But talking about the various types of COVID-19, for example, some I've heard are really dangerous, few are very mild, few have average symptoms for that matter. Do tell us about that. A person who has had a normal or a mild COVID-19 recovered, can that person, for example, if that person goes to meet somebody and that person, the other person is a doctor who is exposed to it with a heavy COVID load, can that person, number A, the first person can get affected, sir?
First of all, we don't know the answer, 100% answer to this.
Okay.
But looking at other coronaviruses, this is type 7, and then looking at other coronaviruses, if you have antibodies, first of all, depend how long the antibodies will stay. We don't know yet. 1 month, 3 months, 6 months. I have patients who have antibody positive since March and they have not been affected again. But there are a couple of reports, even in the United States, that people who are infected in March, they have antibodies, they are coming positive again in June, but they don't have any symptoms. So it means is if you have antibodies, it's possible you can get it again, but you may get a very mild disease or you may get like no symptoms at all. But again, it is too early to exactly tell that whether it's going to like infect at all or whether it's not going to infect at all. Because in measles, chickenpox, once you have it, you don't get it in your life. But regular coronaviruses, which is the common cold viruses, which is NL64, because we have 7 types. So first 4 types are very common corona. So common cold, we say, okay, we have the sore throat and cough, we have a cold. That's common cold is corona. So we do get common cold. 1 week we get better. Next week we
All
get
right.
interact with somebody who has infection again. We get it again. So from that story, I can think we can get it again. But if we have antibodies, we might get it mild. We not end up in a
All
ventilator
right,
and
Dr.
stuff.
Sabha, I've got a couple of more questions for you also, but right now we've been joined in by one of the legislators of Pakistan Tehreek-e-Insaf, Shindana Gulzar Sahiba. Assalamu alaikum ji.
How are you, Ji?
Hello.
Ji, can you hear me?
Yes, you're absolutely clear, ma'am. Ma'am, first of all, tell us about the current update of what's going on in this fight against corona, in particular in Islamabad at the federal level. Now, we've also learned that Zulfikar Mirza Saab has also self-isolated himself after he was discovered that, he has corona, COVID-19 positive results. So what I'm saying is that currently, I mean, it's hitting everyone. I was listening to Sheikh Rashid Saab, he was so scared for the first time, I guess, and a couple of other individuals, Ayatollah Durrani Saab passed away yesterday. So this is something which is very, very serious. I remember Ayatollah Saab never used to smoke or anything, but he was very fit. Just, when he used to meet, I mean, he was such a strong man, but this is what has happened. Ma'am, your comment, your take.
First of all, despite your report about Dr. Zafar Mirza, whom we all wish the best of health, I have full confidence that he will recover, inshallah, and we pray for him. Having said that, today we have a report from London's Imperial College which estimates that the COVID-19 pandemic in Pakistan is on course to fade out. The reason they're saying that is we have something called this coronavirus reproduction rate, the RT. Pakistan's
can you
RT
repeat
is
it again, please?
0.74. Hello?
Yeah, ma'am, can you repeat it? What exactly did you say? We have recovered what?
So Pakistan, London's Imperial College, not WHO, has estimated that COVID-19 pandemic in Pakistan is on course to fade out. The reason they say it is the following. At the coronavirus, there's a reproduction rate, which is RT, and the rate of that RT in Pakistan is 0.74. Now, just to explain a little bit, I'm not a medical doctor, but this is not so hard to understand. An RT of less than 1% indicates each infected person is infecting fewer than one person. Now, the lowest rates in the world for this RT are in Italy, Netherlands, Canada, and Spain. That's it. Those are the lowest in the world. However, for Pakistan, it's not a time to relax. We need to continue to take all precautions. And I'll tell you why. Another good news, even within the region, neighboring India's RT is 1.14, Iran's is 1.12, Bangladesh 0.96, Afghanistan 0.93. And the other report which has come out of Imperial College, which is, alhamdulillah, a very healing balm for those of us in the government who've been talking about a partial or smart lockdown from the beginning, trying to balance lives and livelihoods. What they have said that wearing masks and social distancing in the middle of a deadly pandemic after 100 years, it has infected more than 11 million people globally. It has claimed over 4,500 lives in Pakistan and more than half a million lives globally. What does that mean for Pakistan? Last week's death rates, it has declined to 577 this week. Last week was 869. So what has happened is that the number of people testing positive in Pakistan has declined to 1 in 6 people. And it was at its peak on June 4th, 2020. Then it was 1 in 4.4 people. So this is also Dr. Zafar Mirza's statement. Despite that fact that he's ill, he gave a statement that though these numbers are incredible, and that our peak might have passed, we are still going to be vigilant. We're still going to have sealed hotspots in terms of the legal position from the side of the government. We're still going to watch our weak spots, in particular in Sindh, because while Punjab and Sindh, the testing rate is not the same. The testing rate in Punjab has declined. However, in Sindh, the proportion of people testing positive is much, much higher, twice as high as that of Punjab. So our concern and focus, thanks to the National Command and Operations Center, where all the provinces, all political parties, including the army, are monitoring. Alhamdulillah, the good news is that we seem to be on the path of recovery. And I'll give you an example. There's an article today. I'm not going to read out the article, but if you have a look at it, it's from The Guardian. And it talks about the fact that even though India has one of the world's strictest lockdowns, the cases are still rising. They're arresting people left, right, and center. 2 people died in jail today because the father and son were protesting against the lockdown. They've had people dying in hospital bathrooms and being discovered after 8 days. And yet India's cases are on the rise. There's going to be the top 3 in the world following Russia and Brazil. So that means whatever Pakistan is doing is working well for Pakistan. Alhamdulillah.
Now, these are good news, ma'am. Thank you very much for the update. So kind of you. Now, going back to Dr. Numan, what ma'am was saying, I'm sure you have heard about it, that WHO has primarily declared Pakistan as a country where this COVID-19 is going to fade away soon. And they're looking at the current trend, looking at this percentage. It's a technical formula, I'm sure you must have heard. Can you explain that to us and to our viewers also, Dr. Numan?
Yes, so R naught basically it's the infectivity of the virus. I mean, I think in United States it's somewhere 1 into 6 people. So if one person infects one person, it's like R naught 1, and then if one person infects like 6 people, it's highly infective. But I think honestly, Pakistan, alhamdulillah, is a much, much better shape than most of the other countries in the world. I still feel even as a doctor that it's a rahmat of Allah. But one thing we have to be careful. So in Florida or other states, they said the peak will come in April. So April 16, April 17, there was peak 1,400 cases. But honestly, once they open up, relaxed, every single day is a new peak day. We have 10,000. One day we have 11,000. Next day we have 12,000. You getting my point? So right now, Pakistan is 1,000,000 times better than United States, as far as the infection is concerned, and I think it's improving too. But again, if we let our guard down, again dropping the ball, then we will see another peak, another peak, another peak. To avoid this, what is happening in United States, I really beg people, please listen to it. It is not a joke. I called my village, and they said nobody is taking it seriously. People are
No
doing
one is,
regular.
sir. No one. Nobody even talks about it in the village. They don't have any clue. I mean, they're making funny jokes of it. Is it because these people are not getting it, or maybe even if they are getting it, since their immunity is pretty high, and maybe they are asymptomatic? Is that the reason, sir? Is it possible?
Okay, so I think same thing here. People who are taking it joke, I think most of these people, they haven't got the disease, and they don't have anybody close by who actually got the disease, so they haven't seen the severity, the danger of this disease. I personally have seen it. I have personally seen people are getting really sick. They were literally crying and begging, doctor, do something. I said, what can I do? I mean, honestly speaking, there is no real genuine medication. There is no real treatment. I mean, we have remdesivir, we have Actemra, this and that, but they are not a real treatment. So those guys are learning in a very hard way. But on the other spectrum, the people who are making joke of it, they haven't got it, their family haven't got it, their friends, they are not seeing the reality of the disease, and that's why basically they are like taking it as a joke. But the problem is the day you will get it, there is no going back. There is a huge chance, there's 3% at least a chance that you will die. There's 15 to 20% chance you will end up in the hospital on some kind of medications or maybe on a vent. So that's the problem. People. That's why I think from your effort, my effort, every single day, I'm begging people, I'm requesting people, please.
This is exactly
This
what we
is
try to do, Dr. Saab.
this is
Try to create
genuine. This is a
awareness,
serious
try to tell
threat
people.
to
Now,
whole world.
yeah. Now, Nazir Saab, now talking about this creating awareness, I think enough has been done. So many articles have been written, so many programs have been done. But generally speaking, now, the longer the COVID is staying, people are getting fed up. Honestly speaking, people, I mean, I was talking to somebody and I got to know that the divorce ratios and so many other domestic problems, I mean, they've gone up. Psychological issues exist. People are, their behavior is changing, their mindset is changing. You know, stay home, stay safe is fine, but stay home, stay safe and getting, getting nuts, basically. That's what is happening. So this is something on a rise, and this not only in Pakistan, it's all over the world. So it has its own approach as well when it comes to damaging your mindset primarily, sir. Nazir sir?
Yes, I think it is a very serious issue. You rightly pointed out, not only in Pakistan. The other day I was reading about Mexico. In Mexico, domestic violence increased many times. Otherwise, Mexico is overall, jolly country, people sing and dance and all. But lately, during the past 4 or 5 months, there have been so many domestic violence incidences that they could not control it. So luckily in Pakistan, we have not reached that stage as yet. But I think psychological impact is there, especially for women, because women, a wife or whoever is taking care of the family, now the husband is there at home all the time, all the children who go out for schools or some offices, but everybody is at home. So, you can also see, and I can also see how much under stress our women are. So this is something pretty serious. And, staying home is not the ultimate solution. Even in European countries, people have gone out, and the research is also showing that, if you go out and if you have proper masks, clinical masks, not N95, but even if ordinary mask is used, it reduces chances. But if you don't go out at all, I have seen some of my friends, all the time keeping at home, and, they have some serious repercussions of that. So, to cut it short, I think people need to communicate with each other, maybe by phone, by Skype calls, sometimes, go out to park or somewhere. So staying at home for a longer period of time, for months, is having psychological repercussions, which is not good overall. And ultimately, I think we should also think
when you
about...
talk about the changes in our behavior, whether we talk about the changes as far as our purchase is concerned, it's totally getting towards online trading now. You talk about not going out, that has become the trend. You as a guest, you're not acceptable to anybody's house. Any other guest at your place is not acceptable either. So there is a lot of social change taking place at the same time. Now let me take this point to Ma'am Shandana Gulzar Saiba, that ma'am, a lot is changing. A lot has changed, and I think the world we knew the way it was, it is not going to be exactly the same. Maybe the social norms will change, the social values will change, maybe an additional an addition of a mask, a designer mask is going to be a part of our accessory in the future, I guess, or maybe the gloves for that matter. Things would change, but primarily my point is, ma'am, is the government, at the government level, is the government actually prepared and geared up for the new Pakistan? I mean, I would say this is going to be a new world order, or a new Pakistan. Everything is changed. It is going to change. Are we geared up for those days?
Thank you, Faisal Saab. Let me give you two examples of how the government is doing things ahead of its time that other countries haven't done. To give you an idea of things, one which is pandemic specific, the other one is Pakistan specific. And these are both incredible for any disease in the future. The first one is, you're aware that the government has put out a mapping system. We've got in place in Pakistan right now a centralized system. We're going to have, a modernized version of a national health system. It'll be a cross between the British NHS, barring its failures, and the British CDC, barring its failures, and try to come up with something. A Center for Disease Control, which also talks about health facilities in Pakistan. So the current center that we have, it is with one phone call, and it has its own app as well, which is being launched soon. You can find out which hospital, where in Pakistan, will give you the facility of a ventilator, a doctor, a hospital bed. That has never been done in Pakistan, more so after the imposition of the 18th Amendment, where health is a provincial subject, and rightfully so. But that doesn't mean that diseases and people don't cross borders. It doesn't work like that. The 18th Amendment, the virus is not beholden to the 18th Amendment. So the first brilliant thing that the government has done, again, full credit to NCOC and the Prime Minister's team, that they thought of additional measures while battling the disease. The second thing which happened was in my personal capacity, because my mother and both my sisters were diagnosed with corona nearly 10 weeks ago, 6 to 8 weeks ago. I got a message on both my mobile phones from the National Health Service, and they told me the message was as following, that we have noticed that you are around a coronavirus patient, and therefore you are told to quarantine for the next 14 days. Not only was I found on this contact and tracing on my mobile, the people actually came home to make sure, and it's very difficult to enter Parliament lodges because of the security around Parliament. They actually came to check if I was at home or not and quarantined or not. That is incredible. Even the UK government hasn't been able to do it. Neither has the Indian government, nor the American government. So our quarantine, track and trace system is in place. I'm not saying it's the world's finest, but it's working. And those are two things. The other thing is we've got a hospital which is going to be launched on the 15th of July in Islamabad. We've actually put up that hospital for infections right now for the pandemic, for corona, but in the future it will serve as a base for infectious diseases, a 250-bed hospital. So the kind of rapid response we had during and after is a harbinger of better times to come.
Ma'am, one last quick comment, and that is about the resignation of the doctors. A lot of them, I was watching in the news yesterday, that their resignation has been accepted. And primarily, what I understood was that they were demanding that proper equipment, PPEs should be given to them, and there should be a proper protocol. But is the government thinking of those lines, ma'am, rather than accepting the resignations at such a time when there is such a huge problem being faced by Pakistan and being faced by the paramedical staff and all the doctors for that matter? What exactly has been done?
Now, the thing is, I'm not aware of this development. However, I can give you my guesstimate. The first one is that this must be in remoter areas of the country where the NDMA has not been able to get through. But because
No, ma'am, I'm talking about Jinnah Hospital. I'm talking about some hospitals in Islamabad, some in Punjab.
So, to be honest, I've not seen that story, therefore I can't confirm or comment.
But ma'am, kindly look into that matter, because
Sure.
I'll give you one example. My own brother, he's a doctor in UK, and I was talking to him, and he said that Faisal, we don't have any PPEs or anything. I'm talking about March and April, and there was an acute shortage of
No,
PPEs
let me
even
just, let me just
in UK.
clarify. If this
But what
was
I'm
in
saying
March
is
and
that I
April,
think Pakistan
yes, I've
has done a
understood your
lot.
question.
Being a
I've
poor
understood your
country,
question. Let me respond. I've understood your question. All I'm telling you is that there are two reasons for this. The first one is that, as I said, there may not be the PPEs getting through, which is odd because the NDMA is procuring excess and we're actually exporting many things. So it seems a bit odd, but I can tell you another thing. My own cousin, who's a doctor here in Islamabad, the Shifa Hospital, she did tell me that as a doctor, if you were to resign during the corona pandemic, and a lot of doctors are under pressure from their families, from their wives, from their parents to resign, it is a war right now in the hospitals, and our doctors are frontline soldiers. So it may well be also that some, not all, I find it difficult to believe that Pakistani medical practitioners would do that, but some medical practitioners are using this particular reason to resign because they would rather not work. Maybe they're exhausted, maybe they're burnt out, maybe they're depressed. So this could be a reason they're using, but I don't, as I said, I don't have first-hand knowledge of this matter. So let me get back to you on this one because, as you say, it is not the correct trend for things to go. But I will speak with Asad Umar Saab's team and get back to you because it's an important national issue.
Absolutely, absolutely. Well, thank you very much, Chandana Gulzar Sahiba, for your time, ma'am. Thank you very much. Now, last two quick comments. One, for Dr. Nazir now. Dr. Nazir Saab, now we'll be talking about, let's suppose, the way the ministry or the government says that this is going to get eroded with the passing time. It is going to vanish, inshallah, alhamdulillah, soon. But precautions should be there because only the precautions and the protocols would take us to that level where one day, inshallah, we'll say, we are a COVID-free country. But we have to work really hard on those lines. Now, looking at the current scenario, sir, the longer, because I've asked you this question, the longer it is getting, the attitude of the people, I mean, this is normal. It's getting casual. So once the attitude gets casual, that's where the problem seems to be. Dr. Nazir.
Yes, I think it is not going to go away very soon. As WHO has also pointed out, I think at least for the rest of this year, for the next 6 months, maybe after 6 months, hopefully 2021 will be better. But I think the world and Pakistan should be ready for at least the next 6 months. The virus will be there. Now, the challenge is to contain it, and the government cannot contain it. The NDMA cannot contain it. Only people can contain it. And for people, this attitude to not wear masks, mask is the primary protection. If people don't observe that, it will increase very fast. So there should be a mass campaign, education, information and education through mass media, through TV, through, that this is very important for everyone. Because now, I am in Karachi right now, people are getting infected, previously we did not know, but now we know that somebody, if not in the family, but in somebody else's family, people are getting infected. So yes, the only solution, the way out is that people take care of themselves. They start wearing masks very, strictly, don't go out without mask. This is number one. Number two, we need to take care of our doctors and paramedical staff. And also nobody talks about janitorial staff. These are the people who need our appreciation. Well, we praise NDMA, we praise ministry, we praise everyone, but hardly anybody talks about the people who are there fighting in the hospitals and, taking care of these things. So I think at the governmental level, there should be some awards, as it happens in other cases also. It's a war-like situation. So if something happens, you start praising people and you give awards and you appreciate their efforts. Now, luckily, when this, initially when this COVID-19 came, initially there were clappings and, salutes to doctors. But now gradually in the 3-4 months, we have forgotten all about that. This should not be on. We should start appreciating our doctors, our paramedical staff, and our janitorial staff. If we don't do that, I mean, we are not being appreciative enough. So that's what I have to say.
All right. Now, Dr. Noman Saab, I mean, one thing very importantly raised by Dr. Nazir was about a campaign. Do you think if we just do 3 things, I mean, and make it mandatory, 3 things, we should keep our hands clean, we should always wear the mask when we go out, and number 3, that we should make sure that the concept of physical distancing is there. we should not be very close to anybody, like keep a distance of 6 feet, maybe 7 feet, 8 feet for that matter. We can talk, we can hear. I mean, I've seen people being interviewed from a distance. You know, you keep a mic and get away from that person, you can talk, you can hear. What I'm saying is that these new practices, do you think this is going to be the new normal in year 2021? Let's suppose if that's a better year as compared to this one.
Yes, this is a new normal. Without this, I mean, eventually you will get infection. So I know this is very hard. It's very, very hard. Our question is, there is no other way around. Means we were talking about like psychological impact on the people. Yes, there is a lot of psychological impact. The gun violence, the
Even
domestic
even on
violence have
children, sir.
increased. It's very bad for children. Not
Yes.
going to the school, not playing with their friends. It's very, very hard psychologically, mentally, like even performance-wise. They are going down. But the problem, again, the other side is there is no other way around. Means, yes, there is one thing I do recommend. I've seen a lot of families meeting here, but at a social distance. So they're coming here, they're sitting outdoors, sitting about 6 to 8 feet away. So one thing we need to understand, when we wear a mask, even if it's even a simple surgical mask, if somebody coughs and sneezes, it goes like 1 or 2 inches. But if you're not wearing a mask, then honestly, the research shows that if a cough or a sneeze can actually go up to 12 feet. That's why if we are even in 6 feet, even if at 6 feet, you need to have at least a basic mask.
So when you
So
sneeze,
at
look
least
at the air pressure. I've heard it's over 140 kilometers an hour, that pressure. Is it true, sir?
I don't know exactly the number of
I
air
mean, when you
pressure, but
sneeze, the
I've seen that.
pressure that's thrown out through the lungs, through your nostrils, I mean, it's like 140 kilometers or something, yes?
That number I don't know exactly, but I know I've seen that specific research when somebody coughs or sneezes, it literally goes up to 12 feet. So it means
12
there is a
feet.
pressure there. I don't know the exact number of the pressure, but yes, that much pressure you have that when you cough and sneeze. And again, for to be infected, what I've read from WHO is that you need about 1,000 particles. But in a cough and a sneeze, you have about like a couple of million particles coming out. So you can imagine if somebody is sitting even at 6 feet without wearing a mask and he coughs and sneezes, he's sending like a couple of million particles, and you just need 1,000 particles to get infected. If they're talking, then there's like 20 or 30 particles that they're not much, but it's a cough and sneeze is a problem. That's why if we're sitting, if somebody we're meeting somebody, try to sit as much far as you can, like 10 feet, 8 feet at least, and then see if you even have a basic surgical mask. Even if you don't have N95, you don't have a good KN95, at least wear a basic surgical mask. If you have nobody around, then it's okay. We don't wear masks if there is nobody around
I
because
mean, if you're in your
there's no
room, yeah,
problem.
you're fine, yeah. But I think certain precautions should be taken and they should be mandatory. And every person in every family, one has to be the person who has to ensure that kids, if they're playing outside, they should come in, wash their hands, take shower for that matter. You should have your sanitizers everywhere. Make sure that whosoever is not well should stay, or I mean, even if it's not COVID or somebody is sneezing for that matter, tell that individual to stay in the room. There's nothing wrong. It's all about your safety at the end of the day. Dr. Numan, Dr. Nazir, it was a pleasure having both of you, sir. Thank you so much for your input in this show. And that's all we
Thank
have
you
for
very
this
much.
hour. I'll see you
Thank
inshallah
you so much.
tomorrow at 8. Till then, you take good care. Khuda Hafiz.